Today I will be presenting an intervention to prevent rapid repeat pregnancy in teenage mothers. Here are some facts. Nearly 1 in 15 births to teen mothers aged 15 and 19 is a repeat birth. About 183 repeat teen births occur each day in the U.S. About 1 in 5 sexually active teen mothers use the most effective type of birth control after they have given birth. Infants born from a repeat teen birth are often born too small or too soon, which can lead to more health problems for the baby. There were 365,000 births to teens aged 15 through 19 in 2010. 57,000 were second births, 8,400 were third births, and 1,200 were fourth births or higher. Sexually active teens should use condoms to prevent sexually transmitted diseases and consider using another type of birth control to future reduce the risk of pregnancy. Children born to teen mothers are more likely to enter foster care and interact with the judicial system. Adolescents who experience a repeat teen pregnancy are more likely to have been younger at their sexual debut age, have lower educational expectations, be out of school or not a high school graduate and unemployed. These risk factors are magnified by the fact that repeat teen pregnancy reduces the teen's ability to become self-sufficient and improve her and her children's socioeconomic future. In 2010, teen childbearing cost U.S. taxpayers approximately $99.4 billion for increased health care, public assistance, and foster care, and contributed to lost tax revenue due to lower educational attainment and income among teen mothers and fathers, as well as increased incarceration rates among children of teen parents. Repeat teen mothers are more likely to have a preterm delivery, receive welfare, and have children with emotional and behavioral problems. The intervention and efforts to reduce repeat teen births have great potential to leverage and realign resources in a variety of sectors, including education, Medicaid, home visiting, and social welfare sectors. In general, the most successful program that worked to reduce the first pregnancy combined sexual education with youth development activities and initiated for adolescents at a young age. The most successful program that aimed to prevent or delay subsequent births are those that combine services for the adolescent mother and her child, and those with follow-up of younger mothers for at least 2 years. Interventions that target sexual beliefs and behaviors at the individual level have a greater potential of reducing teen births than those aimed at addressing risk factors at the community level. Will also provide more access to Medicaid family planning services. To help decrease the number of unplanned pregnancies and births paid by Medicaid waivers to states will help enable them to serve women otherwise ineligible for Medicaid, many of whom are teenagers. The Maternal, Infant, and Early Childhood Home Visiting Program, it will be administered by Health Resources and Service Administration with the Administration for Children and Families. It will provide services to priority population, including adolescent teenage mothers and their children, to reduce the incidence of repeat pregnancy and birth and adverse health conditions. Home visiting, which will be available to pregnant women, new mothers, and children, will attempt to mitigate many consequences of teen births that adversely affect the teen mother and her child. The goal is to reduce rapid repeat teen pregnancy as defined by a subsequent pregnancy within 18 months of a prior birth and promote healthy birth spacing among teenage mothers. Through telephone-based care coordination, we will provide motivational interviewing delivered by trained nurse educators and/or services through one of our clinics. They will provide personalized access to contraception via transportation to clinics or hospitals, in person visits from a nurse educator. They will also be referred to additional services as needed. It suggests that contraceptive behavior will change by helping women identify their own reasons for their need for birth control and providing them easy access to it. I will target teens who are at least 28 weeks into their pregnancy or who have recently given birth. The nurse educators will aim to conduct a telephone call with each participant once per month. Calls will vary in length based on clients' interests. The program staff will partner with local hospitals to recruit and enroll youth. And as a social worker, I will conduct psychosocial assessments and domestic violence screenings. My expected results is that I aim to provide a targeted, flexible, and individualized approach to support pregnant and parenting teen women to address their specific needs and questions and promote their consistent adherence to a birth control plan across an 18-month period. In sum, my intervention will use motivational interviewing, contraceptive access, and social service to help at-risk teen mothers adhere to a birth control regimen and prevent rapid repeat teen pregnancies. And now I will show a video of an example of a program that is by Ohio Health based out of Columbus, Ohio.
Ohio Health is a faith-based healthcare organization, and we have 11 member hospitals in the state of Ohio. Our mission is to improve the health of those we serve, and our department, Community Health and Wellness, is really that outside-facing part of our mission of serving the community. The top program is the Teen Options to Prevent Pregnancy, so it's a research project that we've been working on for the last 5 years.
We focus on inter-pregnancy interval, trying to reduce the subsequent pregnancy within 18 months. We know that at this point, 30% of teenagers, when they become pregnant, will have a subsequent pregnancy within 18 months. It increases the risk of prematurity, it increases the risk of stillbirth, it increases the risk that these teenagers will not complete their education. And also the children of these teenagers are not ready for school. The other thing that makes our program unique is that we're actually bringing the contraceptives to the house. We're giving depot at home.
Using motivational interviewing, transportation, home visits, and personalizing the care to the patient. It's truly a patient-centered program. What we've done with the project, we realized that many of the nurses in the hospital weren't aware of some of the new LARC methods, and so we've also been able to educate nurses throughout the 5 hospitals and the 9 clinics as well. So to teach them about the LARCs, to get them updated, will help for the future. And so what's exciting is to think about the changes that could happen if young women don't have that second or third baby, that they can go on with their lives and have productive lives.
The motivational interviewing is a nice, non-confrontational type of communication that helps the young woman come up with her own plan for change. The transportation aspect of the program, I really value that time with them. It's also a nice time to be able to provide education if that's something that they want, and helping to come up with a plan. So there's a lot of things to be able to do with the transportation piece. And then, of course, the home visits, just being able to see where they are, where they're coming from, how they live day to day.
I tell her a lot of stuff, and I really like it because stuff like that you can't really share with anybody. But I feel like she knows what to tell me. She gives me really good advice.
Even though they come here with a mindset of wanting a particular long-acting reversible contraceptive, we still go through all the contraceptives that are available. We talk about the risks and benefits, and then we allow them to make their decision. I think the mistake that a lot of us have made in the past is that teenagers really can't make decisions. And they really do want to make that decision. They have goals. And once we explain how to accomplish their goals and what we can do, it makes life a lot easier.
With motivational interviewing, examining what their goals are, and then saying, okay, so what do you think about birth spacing and how that aligns with your goal? Tell me more about that.
Point out the discrepancy of, you're sexually active with your boyfriend, but you're not using birth control. Tell me about that. Tell me what you think about that. And then we can help them.
I love the fact that it's broader than just talking about contraceptive, that we can actually deal with the whole teenager.
To be honest, I would have probably had my second child already.